Today's healthcare environment is facing unprecedented challenges as a result of an aging population, the increasing prevalence of chronic diseases, rising healthcare costs, and a shortage of skilled healthcare workers. These challenges are redefining where and how care is provided. At OBS Medical, we understand that even in this challenging environment, the acceptable number of adverse events is 0. We believe that with the right technology and processes, designed for both traditional and emerging locations, potential adverse events can be predicted and prevented. OBS Medical is the global leader in the development of predictive algorithms for identifying critical instabilities in acute settings. Our mission is to provide healthcare organizations serving patients in hospital, the community, and at home with a simple, unambiguous call to action for all caregivers involved in the continuum of care to reference and respond to patient deterioration, helping to improve clinical outcomes and patient safety through simplification, risk identification, and prevention. OBS Medical. Data for life. What if you could predict instability in a patient well before there is a clinical crisis? Thousands of hospitalized patients die every year from cardiac or respiratory arrest. These patients often exhibit signs of physiological instability for some period of time prior to an arrest. As the population gets older and sicker, and the levels of acuity on the general floor get higher, the need for a new and innovative approach becomes more evident. Existing early warning score systems can be complex and have high rates of false alarms. In some instances, they are carried out by staff not skilled in spotting the subtle signs of deterioration or instability. There are still over 6,000 avoidable deaths in English hospitals each year due to the failure to recognize and respond appropriately to deterioration. Preventing these events is possible through simplification and risk identification, enabling you to intervene earlier. Visensia, the Safety Index, is an advanced automated early warning system that can initiate intervention before a patient's condition deteriorates. Visensia continuously analyzes the combined patterns of 5 patient vital signs and fuses the data into one objective numerical index. This index represents the patient's wellness throughout their hospital stay and enables caregivers to see trends in vital signs and identify subtle changes in patient condition that are the early warnings of clinical instability, helping address the issue of recognizing deterioration. Having a reliable and automated pre-crisis alert tool for rapid response teams and other clinical teams can help improve response times system-wide, leading to enhanced patient safety and outcomes, addressing the issue to respond. On average, Visensia provides over 6 hours of advanced early warning, allowing you to intervene sooner. When using Visensia, the Safety Index, over a 4-year period, there was a 37.5% decline of code blue responses in the medical surgical unit, a 34.5% reduction in the mortality rates, a half-day reduction in the length of patient stay, and early research using Visensia in the ICU suggested some critical events can be identified 10 hours in advance. Visensia creates the opportunity to improve patient safety and reduce the cost of patient care. As healthcare systems respond to these challenges, increasingly the right place to provide the right care, at the right time, with the right quality, cost, and access, will be in a setting other than the hospital. Tomorrow's focus needs to be about providing proactive models of care, based on early intervention and prevention in the community, and moving away from the existing model of reactive care in the hospital. Until recently, this idea was a vision of the distant future. Now, it has become reality. The use of hospital-grade vital sign monitors and wearable devices are set to revolutionize telehealth by extending the monitoring of a patient's physiological vital signs into the community and the home. Remote patient monitoring shifts the focus of care delivery into the home, providing real-time access to dynamic patient content and feedback for community-based multidisciplinary healthcare teams. In this new paradigm, patients take traditional biometric measurements, answer relevant questions based on clinical protocols, which then provides a holistic snapshot to their healthcare team and empowers patients to become an integral part of their own care program. By transferring Visensia's proven acute care capabilities into the community and home, we are able to offer high levels of patient safety and care to these emerging remote patient monitoring care teams and their patients. Vital sign data and other biometric data is fused into one actionable index, the Safety Index, providing an indication of patients' overall wellness. The community-based healthcare teams can then analyze the results, adjust treatment accordingly, and intervene sooner. This enables caregivers to achieve improved outcomes and patient experience, and allows payers to realize the savings from effectively treating patients in the community instead of the hospital. Visensia offers benefits throughout the continuum of care, from pre-hospital to accident and emergency, inpatient care and outpatient care, in the community and at home. With Visensia, meeting the everyday challenges of delivering quality medical care is now simpler and more predictable than ever before. Visensia, the Safety Index. Brought to you by OBS Medical. Data for life.